As the agreement was called, was meant to prepare African countries for sudden outbreak of diseases such as COVID-19 pandemic. Here, this report on accountability in Nigeria's health sector is being launched by Budget and Connected Development. The report investigates the management of COVID-19 funds and the distribution of vaccines in 9 African countries, including Nigeria.
COVID-19 is here, and we're now coming out of it, which has impacted us, politically, economically, health-wise, and social-wise. But how prepared are we for the next pandemic?
We've still not seen the audited statement of the COVID-19 funds that was spent in Nigeria. But while we were also trying to see what was released as towards on the Nokobo platform, we saw that some things were being purchased and they really didn't meet the value that would have also you would have thought of in the market.
I think a lot of people are getting more aware about the political economy around health systems. The public resources will go through some certain level of what gets prioritized. And if healthcare systems are not prioritized, it's because we have not made them as political as it should be.
One of the findings is that low budget execution and waste has further reduced the available resources for health. This has led to high out-of-pocket spending and an inequitable health system.
70% of Nigeria spend out of pocket to afford healthcare systems. How do we ensure that we invest in public primary healthcare systems so that many more Nigerians can have access to that kind of facility?
I also think it's important to commend the National Primary Healthcare Development Agency. There's a model to build a state-of-the-art primary healthcare center across Nigeria, but there is no political will and needed finances around it. So for us, we want to provide a roadmap that in the next 10 years, hopefully, when we have a robust primary healthcare center that can deliver on the demands of citizens, particularly at the grassroots.
Some primary health cares that are not even, they don't even have light. There are primary health cares that have fridge to store the COVID vaccine, but they don't even have, the fridge are not functional. Some of them are functional, but they don't have light. The infrastructural development of that particular primary health cares are in a decay that you cannot even sit there as a normal person.
For the first time in years, the health sector got a high allocation of 1.17 trillion naira in the 2023 budget. But this is only 5.7% of the 2.5 trillion naira appropriation bill, far below the 15% Abuja Declaration Agreement.
We know we have security, we have economic issues, but like a friend of mine would say, without health, we have nothing. So it's extremely important that we situate conversations around the elections on healthcare systems.
While inadequacies in the health sector remains a challenge, civil rights groups believe Nigerians should insist on knowing the stand of political candidates on ways to reposition the nation's health sector. Georgina Ndukwezaika, Arise News.